Thank you, ladies and gentlemen. Thank you for being here. So welcome to St. John's Well Child and Family Center. We're here with a group of illustrious elected officials, union leaders, community residents, to talk about the importance of being vaccinated and ending the COVID pandemic once and for all. South LA is the epicenter of the COVID pandemic. More people are infected, hospitalized, and die from COVID in South Los Angeles than anywhere else in the state of California. And we're here in order to fight back against this pandemic and to fight back against the history of health disparities and inequities which have caused the pandemic to impact South LA so severely. From the beginning of this pandemic, St. John's had to fight to get test kits, to get treatments, and to get vaccines. When the pandemic started, the Trump administration decided to send the test swabs to the for-profit commercial labs, which then sent those test swabs to the high insurance areas on the west side of LA. We could not get a test kit in South Los Angeles. So we found a local lab, we worked out a deal, and we started testing hundreds and hundreds of people a day. We started a command center to triage and talk to people and let them know what they had to do to protect themselves. And then we were able to secure monoclonal antibodies. When the state sent the monoclonal antibodies, they sent it to the hospitals in the wealthy areas of Los Angeles County, and people could not get treatment in South LA. So we went directly to HRSA, Health and Human Services on the federal level, and we secured monoclonal antibody infusions so that we could treat the people of South LA who were infected. And when the vaccine was rolled out, the first vaccines were sent to Cedars-Sinai and UCLA, and not one vaccine came into South Los Angeles until we had over 50 organizations, unions, community health centers sign a letter and demand that the vaccines come into South LA. We secured 14 freezers. We can store tens of thousands of vaccines at a time. We're now vaccinating 600 healthcare workers a day, and we're prepared to vaccinate hundreds of thousands of people in South LA. But the history of health disparities and the history of discrimination and experimentation on communities of color by the medical community and the political fights in Washington have people afraid to take this vaccine. So we're here today with all of these elected officials who stood with us and got us PPE and secured testing sites and fought alongside this community to make sure we have access to this vaccine, to let the community know that it's safe, that it's effective, and that we need to vaccinate so that we can end COVID soon. So thank you all for being here. I want to introduce our partner in this endeavor from Special Needs Network, Ywca Martin. We've been working together to fight health disparities. We're opening a clinic because of the help of Mark Ridley-Samus in South LA to serve children with special needs and their families. And this effort continues to now get the vaccine out to residents of South LA as quickly as possible. Ywca Martin.
Thank you and good morning. Thank you, Jim, for your leadership on this issue. Thank you to the mayor, to the supervisor, to the council members, to April Barrett, a union leader, and to all the community leaders who are out today. And thank you to the media, because if we are going to address the issues of vaccine hesitancy in South Los Angeles and communities of color, it's going to take all of us working together collectively. The issue of vaccine hesitancy in black and brown communities is real. If you look at the data, the statistics, the polls, whereas 60% of white Americans have already indicated that they would be willing to take the COVID-19 vaccine, that number drops to 40% or less in African American communities. And that's not just with respect to everyday people. That's with respect to our healthcare workers, our frontline workers, those people who are coming into contact with thousands and thousands of people on a daily basis. So we've got a lot of work to do. We know the history of health disparities in this country. We know the reluctance that people of color rightfully have when it comes to trusting the medical community. But we know that working together, we can break down some of the distrust. We can address the distrust. We can address it by listening to our community and providing them with vital information and education. And that starts today. So all of you here today are a part of a larger effort that Jim and I are undertaking, and all of you are a part of, to say to this community that black lives matter, and they matter in South Los Angeles. And that's what the statement we're making today. So we're here today to encourage our healthcare workers, our frontline workers, everyone that falls into that first category that's eligible to be vaccinated. We want them to know the vaccine is safe and that it's available, and it's available in our community. Thank you.
At this time, I'd like to introduce our new supervisor for the 2nd District, Supervisor Holly Mitchell, who stood with us early on to secure testing sites in South Los Angeles and has been a fighter for healthcare equity for her whole political career and indeed her life. Please welcome Supervisor Holly Mitchell.
Thank you, Jim. I don't know about the rest of y'all, but I grew up with that Lysol smell in every corner of my household. When my grandmother thought that mothballs killed everything and they would just be thrown underneath the chest of drawers. So this is an aroma that we all should get very used to. The issue is, can we find it in the store? That's the problem. Thank you, Jim. You know, I'm proud to be here today. And I, at a St. John's dinner maybe a year or so ago, referred to Jim as a superhero. Well, I'm going to change that today because he's a gangster. And I want you to understand what I mean by that. When he says words like he's secured, he went and got and fought for and stood up for those of us in South Los. Secured sounds so sterile and easy to do, and it wasn't. He went and purchased the deep freezers before many others did, and then went and told the state and county, I've got the freezer, so I need some vaccine. So we're all here today because we are going to stand in the gap and support the gangster and St. John's and all of us who are South Los Angeles residents who want equal access to the vaccine, to testing, to all that we need to be safe and well. It's an issue of equity for me. We know that King Hospital is overburdened. We know that King Hospital is standing in the gap and providing stellar, top-flight service to COVID-positive patients who are presenting. So we're going to stand in the gap to protect King Hospital, make sure that other hospitals do their fair share in bearing this county-wide, statewide, worldwide burden. Everybody has to step up and do all that they can. With regard to the vaccine, you're right, Ariva, we do have cause for pause. But I have to say, when I had the opportunity to delve deeply into this issue of vaccines several years ago as a member of the California State Legislature, I was clear that black and brown people were most compliant when it came to vaccinating their children. So we've done a good job in terms of our public health messaging and people understanding the safety protocols for their children. Well, now it's time for us to step up for the elders in our family and for ourselves. You know, the issue with Tuskegee and Henrietta Lacks, there's a difference. Those were experiments on black people. That's not what this vaccine is. And we're watching everyone step up to the plate to be vaccinated. So I don't want people to use those past horrific experiences where we were taken advantage of and abused as a reason to not step up in this moment in history where we are experiencing unprecedented public health crisis. This is unprecedented. Everybody has to understand what we're experiencing. Tens of thousands of new cases a day in LA County. Hundreds of deaths a day. Limited ICU bed capacity. You're all watching the press. We all know. And what we can do is prevention and get the vaccine when our number comes up, when it's our opportunity. We've got to distance, wear a mask, wash our hands, not gather at home, in the backyard, with people outside of your immediate family unit. Those are the steps we can take each and every day, and we must. So I am here because I believe that we have the power, with clinics like St. John's, with partnerships like labor, with partnerships like nonprofit organizations, to come together, communicate directly to our community members, people who trust us and we trust you, with real, factual, timely information. When you have the opportunity to be vaccinated, please do, because trust and believe I will. I'm glad to see everyone is out here today, and please stay safe. Thank you, Ywca.
Let's give another round of applause to our new Supervisor, Holly Mitchell. We feel a lot better in South Los Angeles knowing that Holly Mitchell is representing the second. So thank you again, Holly. We couldn't bring together the kind of media, the kind of community effort without our elected officials. And I'm really honored to be able to bring to the podium next the great mayor of the city of Los Angeles. His efforts in terms of addressing COVID-19 are exemplary, and we are proud and happy to be able to welcome the mayor to this event, because we know that, again, this is going to take the city and the county and the state of California to address the issues of COVID-19 in South Los Angeles. So without further ado, the mayor of Los Angeles, Eric Garcetti.
Thank you so much, Ywca. You've been an inspiration for so many years, and I say decades now. Still so young. But really, of making sure that equity isn't just a slogan, but it is a reality. And Jim is both a prophet and a pastor, to add to the titles. Somebody who fights not just for this community, but for the idea of health as a human right better than anybody I know. And so when you call, even in a busy backyard like this, I'll always say yes. But thank you, Jim, for who you are and what you've been doing. To Holly Mitchell, who knew long before she was an elected official what service provision is about. It's going to be an extraordinary voice, not just for her district, but for this county, the largest in America, of 10 million. And thank you for pointing that truth out, that we can lead from communities of color, and we do lead from communities of color. To my colleagues on the City Council, one who was the previous supervisor we worked so closely with, and I know he had to take off, but I want to thank Mark Ridley Thomas, now council member once again, for his extraordinary work, especially around homeless health and the work that he has done there. To Curran Price, who has, along with me, some things I'll talk about, made sure that equity has been brought into our response from COVID-19 from the beginning in the poorest district in Los Angeles. Thank you for your leadership. And this is my fourth time together with Marquise Harris Dawson in the last, just this week. 2 homeless facilities, 1 opening, 1 groundbreaking housing, and now 2 on COVID-19 this morning we spent together. This is really an extraordinary team, and April and Sharice and all the folks, the Urban League and Mr. Lawson, the work that we are doing together. You see one team here. Excuse me for saying something before I get to the main talking points, but I know there's a lot of cameras here, and I don't think any of us as Americans can pretend that yesterday was normal. So I was taught a long time ago, when you have something to say, you say it, and you say it to as many people as possible. Thugs is a word that's been used against our communities quite often, in black and brown communities, to talk in the wrong way about anybody who's young, who might have lost their way. So let me reclaim that term, because what we saw yesterday were thugs. Thugs who brought an abomination to our nation's capital and who attacked our capital. That's not a capital owned by the senators or the members of Congress. This is the United States of America. A black girl in South Los Angeles owns that capital as much as anybody who lives in the District of Columbia. This is our nation, our family. And it was not just a group of people who showed up there. It was a group of people who were inspired by, who were incited by the President of the United States of America, a sentence I never thought I would say in my lifetime. So it is time to quote you, Mr. President, not to stand by, but to stand down. And if necessary, to leave this office early if you cannot keep the peace of this country and if you cannot keep the oath which you are sworn to uphold. We raise our hands as elected officials to protect our country against enemies foreign and domestic. We saw domestic enemies yesterday, and it is your duty to defend this country. Sorry, just needed to say that. The work that we are doing here is life-saving. This is the 6th event I've been to this week where we're seeing healthcare workers vaccinated. It's actually the second today because Councilmember Harris Dawson and I were at the Crenshaw Christian Center, and we saw that there are too many people still who don't have enough vaccines. So let me start there. We need more vaccines. While we're looking at Washington, let us tell all of our leaders there, we need more vaccines. We need more vaccines. We need more vaccines. But I'm confident this county and our city as a partner will get those vaccines in arms through partners like St. John's, through our Rec and Parks workers, through our public health workers, as quickly as we get those. In fact, we saw not even a line today at Crenshaw Christian, the ability to put 1,000 people through that one site. We need to have 100 of those sites, and we need them to be everywhere where people of color are living. 2 weeks ago, when the Los Angeles County Department of Public Health received the first doses of the Moderna vaccine, firefighters and paramedics were the first city workers to get it. I want to tell you the story of Chief Anthony Hardaway, who was raised and born in Watts. He served on the fire department for 31 years, but the past 10 months, he said, are the toughest he's ever faced. To transport people he knows are dying, to see the faces of folks who have given up hope. And so he poured everything he has into this program, which is the largest of its kind in the country, with a capacity to test up to 46,000 people a day. This testing, the same thing Jim talked about, of not even being able to test communities. So when the vaccine became available, he said, I'm going to lead the way. As a black man, as a firefighter, he stepped up. He did it to protect his family, and I quote him, he said, if there's a chance of beating this thing with a vaccine, I have a responsibility to do it. And that's our message today. We all have a responsibility to do this. He called it responsibility because he'd seen firsthand the impact of this virus on his community and on communities of color. In fact, at the beginning of this pandemic, we stepped up. Remember how around America, black folk were dying at twice the rate of their population in cities across America? We put the first chief equity officer of any big city in America into our response, ramped up testing here in South Los Angeles in communities of color, and became the first big city in America to not just reduce that disparity, but to now bring black deaths under the population percentage at large in the county. That is something we can all be proud of having done. Now in the Latino community, we see this virus raging out of control. Y brevemente también en español, somos el epicentro de esta crisis, y especialmente en nuestra comunidad latina. Aquí en el sur de Los Ángeles, en el noreste del Valle de San Fernando, estos vecindarios son los vecindarios con el impacto más alto en esta crisis. Necesitamos a tomar esta vacuna. We have to make sure we have this vaccine and that we take it. We're seeing, whether it's walking door to door like Councilmember Price and I did, to give masks and tell people to fill out the census forms, get a test. We have to bring this message to our families, to our workplaces, to our block, or else this will not get out there. And to make sure that we have, in the next few weeks, the ability to turn the tide. Please, everybody, stay home, stay distanced, stay vigilant, and stay strong. Because the worst days are right now, and the worst days may still be in the next 2 weeks to come as we watch Christmas and New Year bumps come. The mistrust is understandable, given the history that's been talked about from Tuskegee or Henrietta Lacks' cells, but now we have to step up and lead, all of us. Be the leaders to protect our families, authorized by the best public health professionals in America and our Department of Public Health. And if necessary, yes, shut down what we need to shut down for a couple weeks. And I want to thank our supervisor for leading that to make sure. So stay safe and stay strong. Stay vigilant about your health and stay vigilant about this democracy. And let's emerge from this. Never bet against LA. This is a city of angels, and we will rise again. Thank you.
Thank you, Mayor Garcetti. Thank you so much for being here. It should be noted that we have not had an outbreak in COVID among people experiencing homelessness because of the work of Mayor Garcetti and his office to secure testing and treatment and intervention in homeless shelters and homeless communities throughout Los Angeles. So we have to give the mayor credit because the outbreak did not happen amongst people experiencing homelessness because of his work. I'd like to introduce the leader of the largest union in the state of California, a force of nature and someone who's pretty new to Los Angeles, but has already made her mark in organizing in-home support service workers, IHSS workers, making sure that they, as frontline healthcare workers, are getting vaccinated and partnering with organizations like St. John's, Special Needs, and organizations across the county to fight the inequity that we're talking about today. So please join me in welcoming April Barrett.
Good morning, Los Angeles, and thank you, Jim. It's really good to be here. I don't get to see all of these folks that I am really proud to stand in this fight for justice. As I think of my life's work is about fighting for justice, fighting for equity, for the 400,000 long-term care workers I represent, 200,000 right here in Los Angeles County. But I woke up with a heavy heart, and I thank the mayor for leading the way because now I'm emboldened really to speak from where I am in this moment, where I was dismayed, as I'm sure many of you were, watching the chaos, the anarchy, it was frightening, it was maddening, it was shocking, but I was not surprised. So many people talked about this is not America. I promise you that is who a part of America is. And when people tell you who they are the first time, believe them. But I woke up with hope for the other part of America that I know, that I'm a part of, that I share community with. And so for me, today, standing here talking about this vaccine is about how do we counterbalance what we saw yesterday. Los Angeles, South Los Angeles, East Los Angeles, the Valley, all of us, the West Side, how are we going to show up and show this country who Los Angeles is, who we all can be when we put each other first, when we set aside our own petty desires, our ego, our desire for power, and that we fight for and stand with each other. Let us show the world who America really is, who we can be when we trust one another, when we center love, when we center justice, when we center equity. So let's think about this vaccine in that light. Let us center equity and make sure that the communities, South Los Angeles, that has been disproportionately impacted by this virus, that we get this vaccine in our community, all of the doses that we need to protect one another, right? So let us center equity. Let us center education, right? We know the history of health disparities in this country. We know how people that look like me and many of you in this audience were experimented on, right? The mistrust that we have for systems and government is real and it's warranted. But let's not forget that we were lied to about this virus. We were lied to about this virus. This virus has been mishandled from the very beginning. But let us put that aside and again go forward, educating ourselves, educating one another, so that we can with confidence make a choice. Put that needle in my arm, right? Vaccinate me, because I'm going to do what's important for me, for my family, for my beloved community. I'll be honest, I've been on the fence about this vaccine. I'll wait my turn, right? Y'all go ahead, you'll go first. But today, I am committing to you, when I have the opportunity, I'm going to take it. I'm going to lead, right? I'm going to center being responsible for others in my community, right? So let us center equity, let us center education, and let us center responsibility. This virus is not going anywhere, right? We still have to wear our masks. We still have to practice social distancing. We still have to protect workers. Hold employers accountable for protecting workers. The essential workers have been going to work each and every day. Far too many without the protections that they deserve. So let's hold employers accountable for protecting workers. Let's practice our own personal responsibility and hold each other responsible. So in this moment, in our fight for justice, let's show up and show the world who we are. Let's center equity, let's center education, and let's center responsibility. Thank you.
Let me introduce you to the city councilman from this district. He was originally state senator and now city councilman Curran Price has secured millions, hear me, millions of masks have been donated through his office to organizations like St. John's. If it wasn't for Curran Price, we wouldn't have had the PPE that we needed to test people. So please welcome City Councilman Curran Price.
Thank you, Jim, or as you are affectionately known as, the gangster. And rightly so, Holly. You hit it right on the head. To my elected colleagues, community leaders, this is welcome to the new ninth. I'm just honored to be here with my colleagues to re-emphasize the importance of us just working together. You know, the display in Washington yesterday was certainly an indication of the law enforcement disparities that exist, didn't it? You know, had that been a black and brown crowd as it was earlier in the summer, you know, the troops would be out in coordination from a variety of jurisdictions. Yet yesterday, you know, very little to stop the surging thong of hoodlums. Now, you know, like many of you around here who have been to D.C., you can't even get near those buildings, right? Unless you got a pass, you're on the list, you know, and then you still might have some difficulty depending on where you're trying to get to. So it was just very instructive, again, that the disparities it was on clear display yesterday, just underscoring, again, the need for a more concerted focus on justice. And on working, as I said, working together. But let me, again, just welcome you to the ninth. Special shout out to Jim. We appreciate St. John and all the work that they do, and Ywca, the Special Needs Network, for pulling us together to making our presence known. You know, from the outset, St. John has really been an angel, a pioneer in our community, not only with free COVID-19 testing, but now with the vaccines that are going to help protect our healthcare personnel throughout LA County. Healthcare workers across clinics, doctor offices, and in-home support services are real guardian angels in this process. They are the heroes and the sheroes at the deadliest epidemic that we have seen in our history, certainly. But looking around, I'm proud to be amongst so many selfless individuals who have put and continue to put their own lives online to preserve the future of humanity, fighting through extreme exhaustion, setting aside their fears, sacrificing your well-being and the well-being of others for the greater good. Again, we're just really appreciative of the unique role that healthcare workers are playing in this process. And St. John, as I said, has really been a real leader and a pioneer for us, as well as our city. From setting up mobile COVID-19 testing centers in my district office on 43rd and Central, to administering tests to our students at LA Trade Tech. They've showed up in a big way to serve our most vulnerable populations, testing at local senior facilities and at our helping our homeless neighbors. So they've been on the ground making things happen. And while there is truly a underlying vaccine hesitancy that several have referenced earlier, we know that we have to show by demonstrating that it is safe and that it's possible to help. Healthcare workers are demonstrating your true strength and power by being here today to accept the vaccine and to send a message of hope and confidence to our neighbors and to our communities that it is safe. The COVID vaccine has proven to be safe and effective and will be a significant contributor in reclaiming the sense of normalcy that we all have longed for, to reopen our schools, to revive our economies, to save our businesses. The success of these efforts are going to be significant in our ability to combat the ruthless enemy and the ultimate goal of taking our communities back. And that's what we have to do. But the increase in the number of cases and the extreme loss of life, I know, rests heavily in our minds and in our hearts. And so out of respect to those that have suffered, let's just take a moment of silence in their memory. Thank you. While the vaccine signals the beginning of the end, we still have a long ways to go. So I'm pleading with everyone that's hearing our messages today that when the availability for a vaccine opens up to everyone at facilities like St. John right here, please do your part, seize the moment, take the vaccine, and let's help make sure our community gets back to health. Thank you.
Thank you, Councilman Curran Price, for those encouraging words. And I just want to thank you, April, for being honest about your hesitancy, because it's important that we talk openly about how we feel about this vaccine. And when we ask family and friends, will they take the vaccine? I know in my community, the black and brown folk I talk to, the answer is overwhelmingly no. And that's why we are here today. And I want to give a big shout out to the clinical team at Special Needs Network that are here. We have about 12 of our clinicians that are here, and they stepped up. These are black and brown people that work in South Los Angeles. They go into homes every day. They work with families. They work with kids with autism. And they are working with some of the most vulnerable families in our community. And they stepped up today to get the vaccine. They'll be getting the vaccine on camera after the event, because they want to send a message to other healthcare workers. They want to be a model for those other healthcare workers. They want them to see that they're taking the vaccine not just to protect themselves, but to protect the families that they work with, to protect their own families, and to protect their community. So a big shout out to these workers. Most of them are under 30 years old. So these are young people leading by example. So thanks, guys. Next, I want to bring up the council member from the 8th District, none other than Marquise Harris Dawson, working on the front lines for the 8th District of Los Angeles.
Got to give my Lysol. We've been working together all week. So let's give a big round of applause to our Lysol Patrol. We really appreciate him. Well, listen, I'm happy to be here to stand with my sister, Ywca Martin, who called us and said we need to step up and say something to our folks about the vaccine, and to do it at St. John's Clinic right here on Hoover in the heart of our community, and to stand with my brother from the City Council, the one and only Curran Price, and my sisters in the struggle, our Supervisor, Holly Mitchell, and the leader of the biggest union in California and the most important union in California, our sister April Barrett. Let's give her another big round of applause, all of them. The mayor and I, as he said earlier, the mayor and I have been running around the district trying to do what we can around homelessness and also do what we can around the vaccine. And I was moved by the discussion that we've been having this morning about the fear of the vaccine, because it's very, very real. And there's history, because, I was a little puzzled because I learned about the Tuskegee experiment in elementary school a long, long time ago. And there are young people now who don't trust the healthcare industry either. And I'm like, well, do you know about Tuskegee? And they said, actually, I've never heard of that. They said, have you heard about Henrietta Lacks? They said, no, I've never heard of that. But you know what they have heard about? They heard about Dr. Susan Moore 2 weeks ago, a black woman physician who went to the doctor and said, I'm in pain. The doctor said, there's nothing wrong with you, sent her home, and 2 weeks later she died of COVID. All of us who grow up in households with black mothers, I don't know how many times my mother went to the hospital or went to the doctor and said, I got a headache or I got a stomach ache. And they told her nothing was wrong with her. One of those times, my mother had cancer, as it worked out. And so the distrust is real, and we got a long, long way to go. But the reason why I'm happy to be here today with Jim Manja at St. John's is because we have community clinics where we can get health care that's provided on an indigenous basis by our neighbors, by institutions in our community. So I'm at St. John's because St. John's has situated themselves where St. John's isn't successful unless we're healthy. And so we got an agreement that works out. All of us fought together to make sure, along with Councilmember Mark Ridley Thomas, to make sure they didn't close Martin Luther King Hospital, right? Martin Luther King Hospital didn't fall out of the sky. The community fought for it because they wanted doctors from our community, nurses from our community, to have a facility in our community so they could have people that they could trust to provide health care. And so I'm happy to report we have people we can trust. And we have people that we can trust that are asking us and assuring us that getting the vaccine is safe. And in fact, if we don't do it, we're putting ourselves in even more peril. And so again, proud to be here. And to everybody who's a little bit concerned, come down the street to your neighbor and get the vaccine in case you can't trust anybody else. Thank you all so much.
Thank you, Councilman Harris-Dawson. Councilman Harris-Dawson was the first elected official to call St. John's and ask us to partner with him and start testing in the 8th District. And so we want to thank you so much for reaching out and for fighting to make sure we had testing in South Los Angeles. At this time, I'd like to bring up two providers who've been on the front lines treating patients and fighting COVID. Kamala Harris, who's a pediatric nurse practitioner, and our Chief Medical Officer, Dr. Anitha Mulangi, to just let you know what's going on the front lines. Doctors, please.
She's very happy you made her Kamala Harris for the day.
I'm the other Kamala. I'm Kamala Gibson McElroy, and I'm a pediatric nurse practitioner here at St. John's. I don't want to be redundant. A lot has been said about the vaccine. I just wanted to put a face of the community. I'm a member of SPA 6 since I was a little girl. I went to Main Street Elementary School, Washington High School, and Fauché Junior High School. And I think it's just important that I put a face that I'm just like you. I got my vaccine last week. I actually emailed Jim after Karen Bass's town hall last week, like, hey, Jim, they said they're going to roll out next week. Is that true? So I just want everyone, if there's any message that I can give, it is to delay gratification for the sake of your children. And I think our providers have had an extended exposure to the suffering of all of our community, and for me it's even more impactful because I take care of the small ones of us, and it's a struggle for me too. I miss having my quiet mornings at Hot and Cool Cafe in Leimert Park, or the Metaphor, or going to church at Faithful Central. I live here, so I have stake in all of us being committed to getting vaccinated. do it for yourself, do it for me. I did it for you. And do it for my husband and my children who have to make an ultimate sacrifice for the work that I do. So, thank you.
Good morning, everyone. Thanks for coming to witness the amazing work we have been doing at St. John's under the leadership of Jim Mangia. Communities of color and minorities have been facing lot of healthcare disparities. Even access to health is a problem. So I'm very fortunate to work, and we are very fortunate to work at St. John's, where you can access color no matter whether you have ability to pay or not. And we have been testing more than 50,000 patients so far, and we want to reduce their hospitalizations. To do that, we started the first community health center in the country to start monoclonal antibody infusions in a freestanding clinic like ours. So we are very happy to say that we are the first ones. And not only that, anybody can get the treatment irrespective of their ability to pay. And we are also partnered with our LA County Department of Public Health to start vaccinations for healthcare workers. So my humble request to all of you today is please, recall that fear and apprehension, but no matter what is happening, please don't let virus become the susceptibility for us to get the COVID. Please come forward. Please get vaccinated. Not only get vaccinated for yourself, get vaccinated your family, your friends, and everybody in your society and in the nation, so that we can stop this pandemic and move forward for our health, our education, our life. We want to get our life back, right? So to get the life back, please, please, please get vaccinated. That is my humble request to you all today.
All right, thank you so much, doctors. This is an issue of science. So again, if you have questions, if you're concerned about the safety of the vaccine, the thing you want to do is talk to the medical professionals at St. John's, your own medical professionals, because they can help you understand the science behind the vaccine. Before Chasen Robinson, who is one of the Special Needs Network's clinical members, gets the vaccine, he's going to be the first person to get the vaccine on camera. We have a couple of really important community members here that just want to add their voices, lend their voices to this effort. They represent hundreds of thousands of members in South Los Angeles, and we invited them to be a part of this because, again, this is going to take our entire village to get this done, to get to herd immunity that we've heard so much talked about by the national health experts. We need everyone on the grounds, boots on the grounds working. So I want to bring up the president of Los Angeles Urban League first, and then I'm going to ask Sharice Bremont from Brotherhood Crusade and Cynthia Hurd from the YWCA just to have a couple of words to, again, speak to their constituents about why it's so important to get vaccinated. So, Michael.
Thank you, Ywca. Thank you, Jim, for inviting me to be here. I'm here on behalf of the Los Angeles Urban League. This year, we are celebrating our 100th anniversary in Los Angeles. This is not our first rodeo. This is not the first time we've been through a situation that impacts our community.
I was going to lay it down there.
That's good. He does such good work. Thank you. And we are hearing from our community concern about the vaccine. And I have said to our constituents that we can trust this vaccine. Why? Because the professionals who are looking into this look like us. And that's important. We are here because Ywca and Jim have done the work, have done the homework. St. John's is here saying they want to vaccinate everybody because they have done the work. King Drew is here because they have done the work. The people that we can trust look like us, and we need to follow their lead 100%. I will not spend too much time here. I had a long speech that I was going to give. I was told I was going to be the first one to speak, but I'm coming after every elected official in this town, and I am going to give up the microphone right now. But thank you. Thank you so much for inviting me. But the message is clear. For the sake of our community, we need to trust the experts who have said this is important. And we need to vaccinate everyone in our community right away. Thank you so much for having me. I am proud to be a part of this event today, and thank you so much.
Real quickly, I'm sorry, I skipped. And I wanted to introduce you very briefly to the Director of Pharmacy for St. John's, Gail Butler, who's literally mixing the vaccine, who's delivering the vaccine, who's putting her hands in the sub-zero 94-degree below Fahrenheit freezers to make sure that the vaccines are prepared for our healthcare workers and eventually for our patients and for the communities of South LA. Please welcome our Pharmacy Director, Gail Butler.
Good morning. I'm so happy to be here today. And being African American, I can understand how there are African Americans who are concerned about the vaccine. We talked about Henrietta Lacks, and we've also know that there have been incidences in our families or our friends' families where we feel that the healthcare system has failed us. But I'm here today to tell you that the vaccine is good. It's good for us. And also to remind people of Black people, Latino people, people of all colors, that we have all played a part in the healthcare system throughout, the beginnings of America. There have been African Americans like Charles Drew, who did groundbreaking work with open heart surgery, and Daniel Hale, who developed the blood bank. Well, now there's Ywca Corbett. She was the lead doctor who developed this vaccine. She's an immunologist, and she holds the patent for 5 vaccines that are either developed or going through the process. She said it herself. And so there were also a number of African Americans and people of all colors involved in the development and the process and the studies. They studied people with different healthcare conditions. So they wanted to make sure that this vaccine process was represented with all people and people of color. So that was dear to my heart. And when I read her story and I saw her interview, I felt, wow, this is something that I should get for myself. And I was very happy to get it. I got it. My husband is a provider. He's a physician. He got it. And so we're encouraging all the healthcare workers, please get your vaccine. We're encouraging people of color, listen to the good social media, not the bad social media. Listen to what Ywca Corbett has to say about what she did and how in 2016 she started the work on this vaccine, because it's a COVID vaccine, it's a family of vaccines, and this is one of them. So she already started the work. So when the pandemic hit, her team was ready. So please find out more about this. Get your vaccine. We're going to do well. We're going to survive. We're going to get vaccinated, and I believe in LA County.
Well, good morning, everyone. I'm Sharice Bramon Weaver with the Brotherhood Crusade, a 52-year-old nonprofit that is literally down the street. To Ywca, to Jim, to our supervisor, our council members, and April, rockstar union leader, I'm just here to lend our voice as a community activist to please get vaccinated. Thousands and thousands of students are waiting to get back to school. They are in a crisis around trauma. We need our frontline workers. We need our teachers. We need our electeds. We need our nonprofit partners to understand the importance of being vaccinated. We are people of color. We love this city. We love our community. And it will take all of us, not only our electeds, not only our nonprofit partners, not only our community members, it will take all of us to get vaccinated. So please get vaccinated. Thank you.
Good morning. Good morning. My name is Cynthia Mitchell-Hurd, and I am the Vice President for the YWCA Greater Los Angeles. But more importantly, what I feel is my role as a person that has a family that has provided health care in this city for over 60 years right here in South Los Angeles. We know the disparities. We know that everyone in this community falls under being marginalized. But what's most important is that so much has been said today, and we know it. We know we need the vaccine. We know that we're living in a marginalized community. But what's so most important is that we educate. Everybody has said here today, me included, I was absolutely frightened when it said, okay, it might be your time and your turn to get this vaccination. I called every doctor in my family. Should I? Oh, Lord, what if I grow a second head? What happens? But you know what? We're here today. We're going to lock arms. We're going to lock efforts. We're going to lock money. We're going to lock everything that we have. Because you know what? COVID is not going to win. We have lost so many people. It is horrifying. And yes, when 2021 stepped up, what happened? We continue to lose. But somebody said that we may have thought that our healthcare system failed us. No, it hasn't. COVID is just a bad mamma jamma. It is doing what it is doing. But guess what? Jim, thank you. Thank you, Ywca. Thank you, Mr. Mayor. Thank you to all of the elected officials. You know what? We're going to stick that needle in our arm and we're going to give it every shot that we have. Because guess what? If not, there's an opportunity you may die. So, we got this, we got that. What are we going to do? All I can say is that we also must make sure that we provide every single bit of information that we can to our children. Yesterday, they sat in front of that TV and they saw things that they had never seen in their entire lives. And so for some of us, we have to make sure that, you know what, we tell these kids, don't be afraid of COVID. Don't be afraid of what you're seeing on TV. We're bigger than this. We're better than this. And we're America, and we're a part of Los Angeles County. Thank you.
This concludes the official part of our Vaccinate South Los Angeles event. We are now going to move over to the actual vaccination process. Thanks to everyone that turned out. Thanks to Jim for hosting us at your amazing facility. Look for the Special Needs Network St. John's Autism Clinic coming to Martin Luther King Hospital campus in the spring of this year. And again, big things are happening in South Los Angeles, and they're happening because of you. Thank you.